basal cell carcinoma, what we call rodent ulcers, non-melanoma skin cancers. These are all fairly obvious on the surface of the skin, but again, don't assume it's something relatively benign, get it checked out. A new mole or changes to a mole are classic. So if you have a mole where you didn't have a mole before, or the mole's got bigger, or it's changed in colour, or it's changed in shape, or it's a bit higher than it used to be, or it's a bit lower than it used to be, if it's changed, get it checked out. Again, mouth or tongue ulcer that lasts for more than 3 weeks, again, get that checked out, go to your dentist, that's what they're trained to do. Obvious changes in a wart or a mole. Now, this is quite useful. Has it become asymmetric? Is it different on both sides? Have the borders become irregular? Has the colour changed, especially as it got darker, but not necessarily so? Is there changes in pigmentation? Is there variable pigmentation over the mole? Is it greater than 6 millimeters in diameter, or is it increasing in size? A, B, C, D, E. And E is for elevation. Is there bits that are higher and bits that are lower in it? Now, metastases is meta to change, stasis, place. So metastasis is when a malignant tumour spreads from the primary site where it originated to other parts of the body. And once it's in other parts of the body, it becomes remarkably difficult to treat. And the thing about malignant melanoma is it can look like a relatively small lesion, but have already metastasized. So we need to catch these very, very early. As soon as there is a change, get that checked. Ingestion difficulties or swallowing difficulties, feeling of pressure in the throat or chest, again, lung cancer, esophageal cancers can do this. Difficulty in swallowing, that's dysphagia. That can be cancer in the esophagus or fundus of the stomach or other structures in the neck, or indeed potentially diaphragm. Night sweats or fever. If you are getting wet overnight because you're sweating, that's not normal. Get that checked out. That can be a symptom of various malignancies. It's often what we call a paraneoplastic effect. It's what goes alongside a cancer, but certainly, of course, it probably will be infection or menopause or other things like that, but don't you make the diagnosis yourself. That's the point. This is a possible feature of malignancy. Undue fatigue, if you're tired all the time. Again, many possible causes. Unexplained weight loss. If you're on a diet, you would lose weight. Unexplained weight loss could be something like developing diabetes, or unexplained weight loss could be cancer, because cancer increases the metabolism. That's why people lose weight with cancer and they get this cachexia, this extreme weight loss that can occur with cancer. So unexplained aches or pains, especially if they're persistent. And this is a general principle. If something's going on for a long time, if it's not getting better, normally when we get sick, when something goes wrong, the body heals itself. If it's not healing itself, then there's a possibility of an ongoing disease process that's not healing itself, and cancer is one of those. So these unexplained aches, pains, and persistent features, especially if it's persistent. New blood clots are another possibility, deep venous thrombosis. Bone pain, yeah, that can be a feature of possible blood type cancers. So most times you get these features, it won't be a cancer, but don't ignore it, because the time you ignore it, it could be, or the time you ignore it in a friend, in a family member, it could be. Get it checked out, and the vast majority of times you can be reassured that it's not a cancer and go and live the rest of your life as normal. On the odd occasion that it is a cancer, then treatment is so much more likely to be effective if it's early.
DoctorsToTrust.com. Please share this video with loved ones.